So hi, my name is Chintan Parekh, and I'm a pediatric oncologist and physician scientist at Children's Hospital, Los Angeles, in the University of Southern California. So, this pandemic started, at least in the LA area, around March, and that we think of when we see patients, and it's been very challenging for everyone. And as pediatric oncologists, our biggest concern was how kids with cancer would do with this virus, because we know from before that these kids who get chemotherapy or are going to get transplanted immunotherapy have weak immune systems. So when they get infections like the flu and other respiratory viruses, they tend to get a lot more sicker. Now, for most kids, with cancer, even if they get these viral infections, they will recover. But the bigger problem is what to do with their chemotherapy, because when they have the infection, we have to hold the chemotherapy so that we don't suppress the immune system further and cause more damage from the virus. But on the other side, if you hold it too long, then the cancer can come back. And so with COVID-19, that's been one of the key questions of if these kids get it, then in which kids do we need to hold chemotherapy and how long in a safe way so that to keep that whole interruption to a minimum. And currently, we don't have a whole lot of good data to guide those decisions. And so kind of right now, we all just get together in a room and make kind of a best guess and be like, okay, we'll hold it in this patient for these many days and see what happens. But we really need more data of like how these children with cancer, when they get COVID-19, how do they do clinically, but also how does their immune system respond? And are there subsets of patients where they are able to fend it off versus those where they don't have a good immune response? Because that will tell us ahead of time which patients do we really need to hold chemotherapy for and how long. What we're doing right now in this project is we have a study where kids with cancer, when they get COVID-19 infection, we ask them if they would like to participate in the study. And if they do, then we collect their clinical data for a year to see how they do with infection. But we also collect blood samples from them at serial time points during that year. And then in the laboratory, we study their immune responses to COVID-19, including like, do they make antibodies? Do their T cells respond to COVID-19? What kind of other immune responses do they have? And that data, once we get it, should we think would help us actually make decisions in the clinic about which patients to hold chemotherapy and in which we do not need to do it. So we're all quite excited that the newer vaccines have shown such excellent data in adults. But the key thing to note here is as trials were done in adults who had healthy immune systems. Kids with cancer, when they're getting chemotherapy or they get transplant or even immunotherapy, their immune systems are quite weak. And so there are patients, especially when they're getting intensive chemotherapy, their immune system's not able to respond to vaccines. So we know this from like flu vaccines in the past. Like if you give flu vaccines to children who are getting intensive chemotherapy, they don't actually respond to the vaccine and they don't make antibodies. On the other hand, there are some subsets of kids with cancer, if they're getting milder chemotherapy or they're far out, then they can respond to certain vaccines. So that's an important question to answer as well, like how much immune suppression these kids have and which ones of them will probably be able to respond to vaccine or not. And in pediatric cancer, numbers is always a problem when you do research. If you have small numbers of patients, it's hard to make conclusions. So we think that our data, along with data from other centers, will actually provide immune response information as well as clinical information that will help make guidelines of like how much chemotherapy to hold and which patients to hold them in. And will help clinicians in the long run manage these children better, both from the COVID-19 infection perspective as well as from their cancer perspective. It's a great question, and it's been $1 million question of why kids get affected less, mainly because if you could identify the reasons, then maybe you could design better treatments for adults. There have been several studies and several possibilities that this data seems to indicate, although we don't clearly know for sure what the real answer is. So when there is COVID-19 infection, first thing the virus does is enters the cells in your nose and your lungs. And to do that, it enters the cells through proteins on the surface of the cells that are called receptors. And these receptors are basically doors, so they allow the virus to get into the cell. Once the virus enters the cell, the immune system actually gets alerted that there is an invader. So it triggers off an immune response that tries to eliminate the virus. And in most people who get COVID-19, the immune system is able to eliminate the virus. They have symptoms for a few days and then they get better. Unfortunately, in some patients, it's very severe. And what happens there is the immune system response is not very efficient. And so instead of just eliminating the virus, the immune system gets extremely revved up and causes a lot of inflammation. And when you get that inflammation in your lungs and other parts of the body, that makes you very sick. And then you may end up like in the ICU and need a lot of support and treatments. So in terms of differences between adults and children, there's data that shows that in children, in their cells in the lung, the level of these doors through which the virus can get in is lower, which means the thought is that possibly these cells in the lung are more resistant in children from the virus from entering in and causing the infection, which is why they may have less severe illness. The other thing that's been shown is that the immune system actually changes with age. So the immune system in a young child is different from that in an old adult. And so, at least with COVID-19 infections, there's some data showing that in children, when they have an infection, their immune system responds with less inflammation compared to in adults, which is why they probably don't get as sick. And then the third thing that people have looked at is in adults who get sick, a lot of them tend to have other problems. One of them, the key one that's been found, is obesity. And the prevalence of some of these other problems is much lower in children, which is why they probably don't get as sick. So there's a multitude of reasons that may explain why children get less sick. But if you could figure out like the whole mechanism, I think that would help develop better treatments too. However, in general, anecdotally, we've noticed that from an infection perspective itself, most children with cancer who get COVID-19 infection do okay, that they are able to recover from the infection. However, the bigger challenge for us is then what to do with the chemotherapy, and that's where we need answers.